Angina or angina, depending how you pronounce it. Some people they prefer to pronounce it angina, and some people they prefer to pronounce it angina. So I prefer to pronounce it angina. Angina is a chest pain or discomfort caused by reduced blood flow to the heart muscle. It is often a symptom of coronary artery disease. Angina can feel like uh, pressure, tightness, or pain in the chest, and may also radiate to the arm, neck, jaw, shoulder, or back. Triggers include physical exertion, stress, and certain activities. Treatments involve lifestyle modification, medication, and sometimes medical procedure to improve blood flow to the heart. Let's talk about the causes of angina. Myocardium, which is the heart muscle, do not receive enough oxygen or blood flow through the coronary artery due to the following causes. First, atherosclerosis. Here is the picture for atherosclerosis. You can see the yellow thing, yellow plaques, they are atherosclerosis. The second one is coronary artery spasm. If you take a look at this picture, you can see the coronary arteries has a spasm. Now, thrombosis is the third cause, and emboli could be the fourth cause. So, what is thrombose? When the blood clot, like this picture, when they get together and form the clots, it's thrombosis. When they start to move, it is emboli. Angina symptoms. What is the most common symptoms that a patient with angina present with? It's chest pain. I would like to divide this chest pain into three parts. Basically, I'm giving you guys the characteristic of the chest pain, which is the patient will present with pressure-like chest pain, or they will have crushing sensation, like this picture. You can tell from his facial expression that is crushing him, and it radiates. Usually, it radiates to the left arm and back. Now, let's talk about types of angina. In terms of pain and how it occurs and how it relieves, once the chest pain happens, it is divided into two parts. One, stable angina and unstable angina. For unstable angina, it happens due to exertion, but it relieves when the patient rests or take nitroglycerate. On the other hand, unstable angina, it occurs at rest, but it does not get relieved by rest or taking nitroglycerate. Let's talk about diagnosis of angina. So, again, I would like to divide it into three parts. The first and the most important diagnostic step is ECG or AKG. When you do an ECG for a patient with angina, you will see an ST depression. Here is the graph, and here is the depression of ST. It actually doesn't show it, but with the arrow, so it's pointing downward. The next step, which is more sensitive, is stress test. You ask the patient to walk on the treadmill, and then you do the ECG. What if the patient cannot walk? Then you use pharmacological stress test with what? Dobutamine and persantine. After stress test, we do angiography. For angiography, radial or femoral artery approach. Usually, they prefer to use the femoral artery. For the angiography, it provides more information comparing to the other investigation, and it gives you information about the location and the percentage of block. It's not only diagnostic, but it's therapeutic as well because it leaves a stain and provides more room for the blood to move. Let's talk about the treatment, which is the fun part of the angina. All right, so we have non pharmacological treatment and we have pharmacological treatment. For the non pharmacological treatment, we address the issues of smoking, hypertension, diet, and lipid. If the patient has bad habit of smoking, so we have to deal with that and we have to address that. We have to encourage him to quit. And if the patient has hypertension, we have to address that. If the patient is using too much fast food, we have to consult the patient and ask him to bring some changes in his diet. With a pharmacological treatment, we have to start antiplatelet medication like aspirin, clopidogrel, which is preventing from platelet aggregation, beta blocker because it decreases the heart rate, it decreases the blood pressure, and eventually it decreases what? The myocardial oxygen demand. Eventually, it decreases the risk of ischemia. Nitroglycerin, it's a direct vasodilator and it helps the blood to move. Angina treatment. But the best treatment so far is stent placement. And this is how the stent is placed, and this is how it helps. And the last but not least is cabbage or coronary artery bypass grafting. All right, let's do a few multiple choice questions. So the first question that we have, or the first scenario that we have, is a 55-year-old male presents with a chest pain that occurs during exertion and relieved by rest, stable angina, right? The pain described as pressure-like sensation radiating to the left arm and lasting for about 10 minutes. All keyword for stable angina. He has a history of hypertension and hyperlipidemia. There are no associated symptoms such as nausea and diaphoresis. What is the most likely diagnosis? Unstable? No. Is it stable? Yes. Is it myocardial infarction? No. Is it pericarditis? No. The correct answer is B. It is stable angina because it has all the characteristic of stable angina. The second scenario of this lecture, a 62-year-old woman reports chest pain at rest. Chest pain at rest is unstable angina that has been occurring more frequent over the past week. The pain is severe, lasting for 20 minutes and is not relieved by rest and sublingual nitroglyceride. So we already know that we have what? Unstable angina. So let's see what is the question. What is the most likely diagnosis? Is it unstable angina? Yes. Is it stable? No. Is it GERD or GERD? No. Is it aortic dissection? No. The correct answer is A, because it has all the characteristic of unstable angina. So this should be actually 3, not 2. But anyway, last scenario of this lecture. 62-year-old woman reports chest pain at rest, unstable angina, and has been occurring more frequently over the past week. The patient is in severe, lasting for 20 minutes and not relieved with the rest and sublingual nitroglyceride. She has a history of coronary artery disease and was previously diagnosed with a stable angina. She is anxious and appears pale during examination. What is most likely diagnosed? Again, I think we have the same scenario probably. Unstable angina is the correct answer. Yeah, probably that was repeated scenario. My bad. Okay, last case of tonight. A 68-year-old male present in the emergency department with a chest pain at rest, which started 1 hour ago and has been worsening in intensity. He has a history of coronary artery disease and diabetes. The pain is not relieved with sublingual nitroglycerin, and the ECG shows ST segment depression. His blood pressure is high and appears anxious. What is the best treatment? How long is that? 1 hour ago is 60 minutes. So the PCI, less than 90 minutes, you have to do the PCI, percutaneous coronary intervention, because it's 1 hour. So it fits the criteria for PCI. Thank you very much for watching this informative and educational video. This video is prepared and posted by me, Dr. Muhammad Nasir Jallah. The main purpose of this informative and educational video is to keep Afghan female medical doctors, students, and healthcare workers up to date with the latest medical knowledge, especially those who are deprived from their basic right, which is to study and save lives. It is also aimed to raise health awareness for all Afghan in Afghanistan. This informative and educational video may also help and benefit international medical graduates who are preparing for their licensing exam for NACOSCI and MCQ1. Thank you very much. If you guys have social media, I would love to hear from you guys, and I would love to see you guys like and share my page and support us. Thank you very much. I usually um, use a lot of resources for my videos, my educational and informative videos, but the most common resources that I use is Trantanote and U Word Usimile.